See, while fans look at the pitch and see a beautiful tournament, public health officials are looking at the exact same event and seeing a giant, global pathogen mixing bowl. Just look at this staggering alert from the Pan American Health Organization. When you bring hundreds of thousands of people together from literally every corner of the globe, you aren't just mixing cultures, you're mixing local transmission cycles. You're triggering a massive potential spike in cases, which is exactly why local authorities are on such high alert.
To see how Houston is preparing, we're going to unpack the official epidemiology packet by looking at the hidden World Cup, our Tier 1 threat of measles, the dengue amplification risk, and the behind-the-scenes defense.
Starting with Part 1, the hidden World Cup, and decoding that threat matrix.
So as fans fly in from places like Germany, Curacao, and Saudi Arabia, officials are heavily evaluating specific endemic diseases. And I want you to notice something really interesting about this matrix. Look closely. They explicitly skip ranks 3 and 4. They literally just left them blank. That's not a typo. They did this intentionally to clearly signal to emergency responders that our top 2 threats, measles and dengue, sit in a dangerous league of their own. The composite risk of those 2 completely dwarfs the rest of the list.
Which brings us to Part 2, our Tier 1 threat, measles.
This is absolutely not just some theoretical worst-case scenario hazard. Actually, scratch that. It's a highly active, real-time crisis. That PAHO alert we mentioned, it reported over 20,000 confirmed cases across the Americas in 2024 alone. For a disease that was considered fully eliminated from the Americas back in 2016, a resurgence of this scale is a massive wake-up call. It's largely being driven by decreased global vaccination rates, which becomes a huge issue as fans from Europe and Central Asia get ready to pack into massive indoor arenas.
And this staggering transmission rate really explains why an indoor arena full of under-vaccinated clusters is a public health nightmare. Measles is airborne. It doesn't require any physical contact whatsoever. The virus can literally hang viable in the air for hours after an infected person has left the room. With an R0 of 12 to 18, it's one of the most contagious viruses known to humanity. All it takes is one infectious fan cheering in an enclosed concourse or a busy hotel lobby, and boom, you trigger a massive localized outbreak.
To ground this in current reality, we just have to look at Jalisco, Mexico, which is a fellow World Cup host city. They are currently the epicenter of a major outbreak with over 1,100 confirmed cases, to the point where schools have had to suspend classes and face masks are mandated again. PEO is actively requesting extensions for outbreak control. Logistically, this is happening after the Trump administration previously withdrew from the World Health Organization, leaving cross-border health infrastructure under immense strain. And you can bet Houston's medical teams are taking serious notes in all of this.
Let's pivot to Part 3, the dengue amplification risk.
So while measles is this terrifying indoor airborne threat, dengue brings a completely different environmental twist. Unlike measles, dengue is vector-borne, relying on local Aedes mosquitoes biting an infected traveler, say someone coming from Cape Verde or Curacao, and amplifying the disease locally. It's a human-to-mosquito-to-human transmission cycle. Since Houston already has an established population of Aedes mosquitoes, if a fan arrives with the dengue virus in their blood and gets bitten while hanging out at an outdoor fan zone, well, that local mosquito can then pass the virus right on to a Houston resident. It's a highly credible risk for local entrenchment.
And the environment is basically rolling out the red carpet for this. Fans coming in from Northern Europe are going to face a brutal 15 to 20 degree temperature jump. You've got fans from Germany or the Netherlands used to mild 70-degree days getting dropped right into 91-degree heat with 75% humidity. That kind of climate shock isn't just uncomfortable. It happens to be the absolute perfect breeding ground for dengue-carrying mosquitoes. That extreme heat risks severe dehydration for unacclimated fans, which, welcome to Texas summers, right? But it also supercharges the local mosquito population exactly as the games kick off. That's why the public health messaging is going to heavily push drain and cover, protect yourself from the heat, and whatever you do, don't let mosquitoes bite you.
Okay, Part 4, the behind-the-scenes defense playbook. Identifying the threats is honestly only half the battle. The real work is setting up the logistical tripwires. Look at this timeline. It is a terrifying race against the clock for epidemiologists. Post-exposure prophylaxis, or PEP, has to be given in these incredibly tight windows to break the chain of infection. If someone with invasive meningococcal disease walks into a crowded dorm, health workers have less than 24 hours to track down close contacts for antibiotics. For measles, it's just 72 hours for the MMR vaccine, or up to 6 days for immune globulin. It is an absolute non-stop logistical sprint. To actually win this race, hospitals and EMS are actively staging specific medical countermeasures.
We're talking IV fluids, antibiotics, aggressive local mosquito control. They are literally pre-positioning stockpiles of immune globulin and mapping out isolation wards. And their protocols are already changing. If you call an ambulance in Houston with a fever and a rash, the very first question EMS will ask is, have you traveled internationally or been to a World Cup venue in the last 21 days? Plus, Harris County is completely syncing up their mosquito trapping and spraying grids around these mass-gathering zones. It is a fully integrated, multi-agency shield.
As we wrap up this explainer, I want to leave you with this final thought. When the entire world comes to your city, are we truly prepared for the invisible passengers they bring with them? The Houston 2026 playbook shows us that hosting a massive global event isn't just about building stadiums or selling tickets anymore. It's about recognizing that in our highly connected world, a health crisis on the complete opposite side of the globe can literally land in your backyard overnight. Protecting a city means looking way, way beyond its borders. Thanks for joining me on this deep dive. Stay curious, stay informed, and I'll catch you in the next explainer.